Hey, hi everybody, and I can officially say happy holidays to you. I hope everybody had a wonderful and safe Thanksgiving, and you ate all the right foods. Remember I told you as far as the last time, it's not really that difficult if you just understand the low glycemic, high glycemic. You need foods. You just want to balance those things off. You can have more of one than the other. If you have any other questions on that, feel free to write me, or again, check the video because we save each and every one of these for individuals. This is number 43. We've had so we'll be saving this one also, and so that way you can check back on all the subjects that we covered. You know, a lot of people have asked me over the years since I've been working with fibromyalgia since really 1990, and they ask me, well, you know, what's the big deal? You know, how'd you end up getting into fibromyalgia, and how did it start, and so forth? I think it's very, very important that people understand a doctor's motives and drive and so forth. And so I thought I'd spend this time to explain to you why I'm so responsible and why I have such deep feelings for fibromyalgia in itself. Matter of fact, it all started in 1990. Matter of fact, I was in my clinic and I was doing some reports, and all of a sudden my office manager came in, Pam, and she said, a lawyer would like to speak to you concerning a patient. And so I got on the phone, and the bottom line was that he said that she had had an automobile accident, and that automobile accident apparently triggered this condition called fibromyalgia. When I thought back, and it had been at least a year since I had seen that patient. She was just about 20 at that time. She was a college student, and she was studying, and probably overdid it. Yes, college students sometimes do study. Anyway, she had like a stiff neck and some headaches, and so I think we treated her maybe 3 times, and that was it. So we hadn't seen her between that time, and apparently I was the last doctor to see her between the accident and this triggering fibromyalgia. As a note, by the way, fibromyalgia is the higher level of fibromyalgia is triggered by some physical, emotional, chemical trauma, such as automobile accidents, deaths in the family, surgery, so forth and so on. So anyway, I had no information in 1990 on fibromyalgia. I knew what the words meant: fibro, tissue, myalgia, which is aching pain. And so I didn't have any, at that time, you couldn't Google things in 1990. So what I did was I called the University of Arizona Medical School Library, and I said, do you have anything on fibromyalgia? And they called back and they said, yeah, you know, we have a paper. Matter of fact, it's recent, 1990, perfect, on fibromyalgia from the American College of Rheumatology. So I obtained that. And I got it, and I always joke, before that I didn't need glasses, but after I got this paper, which was I think 17 pages long, a very, very small print, but it was very in detailed research on fibromyalgia, not only naming it, but also explaining the studies and so forth, and how at that time you could actually diagnose fibromyalgia. And so I studied that paper, and I went to court. And the lawyer on the other side never called me doctor, and he tried to make a fool out of me. As a matter of fact, there was a court where they actually had testimonies that were being given. And so every time I would answer a question that he'd ask me, he'd look at members of the court, and he'd kind of laugh and giggle and so forth and so on. So finally, he asked a question he probably shouldn't have. He said, so you're getting all this information from your chiropractic school? And I said, no, it's actually from this research paper from American College of Rheumatology, so forth and so on. And the jury, there was a jury at this time, kind of sat up at attention. I was the last one to speak at this case. It was actually 3 days old, as a matter of fact. And every doctor in the world from A to Z, I guess, had testified and said there was no such thing, and everybody was there for the old term green salve or money. And so when I actually mentioned there was a research paper, everybody kind of sat up. And but the judge wanted to look at the paper first, so I gave it to the bailiff. The bailiff gave it to the judge. He checked it, and he actually looked at it very, very closely. I swear for a couple of minutes, and finally he said, "Yeah, this is a research paper that's valid. Doctor, can we make copies of this for the jury?" I said, "No, actually, I made extra copies for the jury." And I looked at the lawyer from the other side. I thought he was going to have a heart attack. But anyway, I handed the articles to the bailiff, and he handed them out to the jury, and they were like cats lapping up milk because I guess they were just really tired listening to all these opinions. And research always beats out opinions, and so that's very, very important. Hi, Shelley. So anyway, bottom line is that my patient at one time who had an automobile accident and triggered this high level of fibromyalgia won this court case. Matter of fact, I still have the paper. She not only did she win the case, but the jury, I guess, penalized the lawyers on the other side, and they can, for trying to make her out as a criminal or some kind of crazy individual. And so she won $125,000, which was the largest case in 1990. It was the largest case in the history of the courts as far as fibromyalgia is concerned. And hello, Shelley. Hello again. Good afternoon. But anyway, bottom line is that from that, apparently the word got out, and I started getting fibromyalgia patients coming to me because apparently I had more information than most other people. And it was really from this research paper, which is still the basis of research for American College of Rheumatology in 1990, although they brought out new updated information and so forth, but that's the bottom line. But I was getting these patients in from fibromyalgia because apparently I knew more than anybody else at that time in the area. And so I started treating them with everything I had professionally. I had chiropractic, physical therapy, rehab, acupuncture, cold laser. I was taking seminars on different things. I started coming out with seminars how to treat fibromyalgia patients and what fibromyalgia was. So not embarrassing anybody, but I think I knew more than most of the people that were trying to treat this. There were water therapies and all sorts of electrical therapies, so forth and so on. But I went back and I started working with these fibromyalgia patients in earnest. And I helped them somewhat. Chiropractic does help secondary conditions. It helps the symptoms, so forth and so on. Really does not get to the point of the condition itself. And so I was about ready to give up because I have a lot of pride in my profession, and I just don't want to treat people just to keep them coming in. I wanted to have an answer, and lo and behold, two things happened in 2000. One was very, very sad. The other one was very, very important as far as my working with fibromyalgia patients. In 2000, March of 2000, in one of our newspapers' headlines, a lady commits suicide due to lack of information from the medical society, so to speak. And what happened was she was 30 years young, married with 2 children, husband, and apparently she had fibromyalgia, but nobody was able to diagnose it. She went from doctor to doctor, hospital to hospital. She needed something because she was in so much pain. And initially they were starting to give her medication, but they couldn't find any objective tests. You've heard that before by me. All the objective tests are negative. And then they started treating her like she was some sort of psychotic, it's all in your head. Also a druggie because she wanted to have drugs for her pain, on and on and on. So one day, in severe pain, apparently, she made breakfast and lunch for the kids, and the husband sent them off, drove out to a highway not too far from here, and walked in front of a truck and killed herself and left a letter behind saying that nobody believes me, I'm not crazy, and I have this painful condition all over my body, and I can't handle it anymore. And so they did some more studies on her, and they found out, based upon a letter and her studies, that she had fibromyalgia. And to this day, I've looked to see how many fibromyalgia patients actually have committed suicide, and there's no real record for them. But anyway, that was in March, and I felt so bad about that. Today, I still have a problem as far as accepting that our medical community would not accept an individual coming in just because it didn't fit into their objective testing, so to speak. I was heartbroken by this, and I said, I've got to find an answer. I've got to find an answer to help these people because otherwise nobody's going to help them. About 2 months later, I received a 3x5 postcard from a doctor in California, an MD, who apparently had found an answer to treating fibromyalgia as a condition, and that he was coming into town, and he was going to have a seminar on this. And doctors and patients were actually invited. Well, I'd gotten other cards from other people, but I said, okay, well, I'll go. And it was to a pretty large hotel, as a matter of fact, a resort in Phoenix. And I figured, well, it would be in another back room like the other 15 to 20 doctors would go to these seminars. So I went Friday afternoon after I'd worked Friday morning with patients, and I walked in. I said, I'd like to know where this seminar on fibromyalgia is. And the woman said, you see that table over there with all those people standing there? She says, go there and they'll check you in. I couldn't believe it. I said, what the heck is going on here? I went over, and they had separation of patients or prospective patients or people that are interested in fibromyalgia versus the medical field area. So I went to medical and I signed in, so I started asking these people. I said, and I first started asking patients that were there, what happened? This doctor has got this great answer for my condition, and I was in bed. Now look, I'm able to walk. I'm back to work, or I was in a wheelchair. No, I mean, look at, I went from a wheelchair to a walker. I'm getting better and better. I couldn't believe this. I couldn't believe it. I got to find out who this person is and how they were helping the fibromyalgia patients. So finally, at the end of the day, Friday, I introduced myself to Dr. Saint Amand and president of his research company, Claudia Merrick. And I said, I don't know. I told him my history in working with patients. I said, I'm looking for an answer, and hopefully you'll be able to help me. And so I spent the next day and a half following them around, and they were training other doctors, including myself, in their protocol. And I was very, very excited to see this. So I took it back to my clinic, and I started working with patients. Now, he's an MD. He's a researcher out of UCLA. He has his clinic and so forth. And I guess patients follow MDs a lot more closely than if a chiropractor were to say, I've got this answer for you. And so his protocol, especially for the really severe individuals that could hardly function, took too long. It took maybe a month and a half, 2 months, and that was too long for patients that I had. The more simplistic ones that maybe not as severe, they were being treated and they were getting well. But I was losing a lot of patients because it took too long. So what I did was I looked at the evaluation and I said, okay, I'm going to have to take care of a lot of the secondary stuff that's working on these patients. As I mentioned before, every fibromyalgia patient has not only fibromyalgia, but other conditions. It might be just one, it might be multiple, but they have other conditions. And I call it kind of white smoke because it kind of interferes with the fibromyalgia, differentiating fibromyalgia from these other conditions. And so what's the one thing that's most common in all conditions? Inflammation, the inflammatory response. Well, what's the one thing I could really control? Maybe I can't control it, but I can very strongly evaluate a patient and push them towards this protocol. And so what I did was I said I can control their dietary intake. So what I did was I produced a what we call a pre-protocol that lasts for about 2.5 weeks, where we place them on a restricted hypoglycemic diet. I've talked to you about this before, where we take sugar, gluten, trans fatty acids out of the patient's diet. And that reduction of inflammation is almost immediate. Literally within a day or two, they start coming in and saying, wow, I can't believe that, I'm starting to feel better. For those that stuck on it, that's the key. You have to stay on this. I also put them on a liver and kidney detox because so many of the patients had so many medications that they were taking that their liver and kidneys were not able to function properly, and so they were getting clogged up, and so we needed to take care of that. And the detox also included high levels of protein and nutrients they weren't getting. We put them on high doses of omega-3, which is an anti-inflammatory and also a brain stimulant. We put them on something called CLA, conjugated linoleic acid, where Dr. Perricone used that as one of the 8 major things that he suggests to women. The CLA actually burns fat off your body, and so we put them on that initially during the pre-protocol. We also put them on magnesium, which is a stimulant for the mitochondria, which are being burned out, and that's why they have so much fatigue and so much of the non-functioning of the body itself. So we put them on these aspects, and they started feeling better during this 2.5 week period, so that when they started the protocol with Dr. Saint Amand, that the response was much more aggressive and quick, shall we say. It was just one step after another instead of just waiting and waiting. Dr. Saint Amand's protocol, and he has found not the specific gene, but he knows that there's a genetic marker, they're still looking for it, that you're born with, that actually causes this. It actually causes the cells to accumulate excess amounts of phosphate and calcium that causes the mitochondria to be burned out, your immune system to be more susceptible to other things, so forth and so on. So that's my story. It started in 1990. By 2000, with frustration, about ready to give up, but then the suicide actually occurred, and that still bothers me. I've kept that headlines I put in my clinic. And then Dr. Saint Amand. And it took me years, but I actually wrote my own book on fibromyalgia, falsehoods, fakers, and facts. Also a CD on the pre-protocol because I was so frustrated with patients coming in and doctors just giving them medications that really don't work. I mean, they cause more side effects than anything else. So I guess this would be considered a sales item. Yeah, look, if you're suffering from fibromyalgia, you know somebody that's suffering from fibromyalgia, it's not a reason to give up. There's an answer. Ours is the only protocol that we know of that treats the condition. It doesn't treat the symptoms just by covering them up with medication and so forth. It actually delves into and treats the condition. And during this period of time, since 2000, I've had patients that are living normal lives. They're able to function, go on vacations, decide on what they want to do tomorrow or the next week, be pain-free. That's what you want, isn't it? You want to be able to live a life of enjoyment and be able to enjoy your spouse and children and grandchildren, regardless of what age. So I want to wish everybody a wonderful, happy holidays during this period of time. We'll be doing regular Monday, 12:30 blogs, shall we say, video blogs on different subjects that are health, very important for health preservation, shall we say. In the meantime, any questions? Stetson Chiropractic Clinic and the Fibromyalgia Wellness Center, we're available for you. A lot of people do send in questions and so forth on my talks or just in general. You're more than welcome to do that, and I'll get back in touch with you as quickly as I can. Again, this is Dr. Kenneth Muich, thanking you for joining, and also wishing you a very, very happy and healthy holiday season during this time. The answers are here. Don't just shake your head and say, no, I give up. No, they are here. They really are. We work with patients. By the way, one last thing. We actually have prospective fibromyalgia patients talk to fibromyalgia patients that have gone through the protocol. So you don't think of we're just kind of putting you on. Anyway, have a wonderful day. Have a great week. Super. And we'll see you next week, 12:30. Let your families, your friends, and your doctor and so forth join in. We're more than welcome to answer any questions and join in the discussion. Take care, everybody. Bye-bye now.